How do doctors diagnose COPD with lung function tests? Imagine trying to breathe through a straw all day long. That's what it can feel like for someone with chronic obstructive pulmonary disease. To figure out if you have this condition, doctors relying heavily on lung function tests. The main test they use is called spirometry. It's a simple, quick procedure where you breathe into a tube connected to a machine. You take a deep breath and then blow out as hard and fast as you can. The machine measures how much air you breathe out and how quickly you do it. The key numbers doctors look at are the forced expiratory volume in 1 second, or FEV1, and the forced vital capacity, or FVC. FEV1 is how much air you can force out in the first second of a breath. FVC is the total amount of air you can blow out after taking a deep breath. When doctors compare the two, they get a ratio. If this ratio is lower than normal, it shows airflow is limited, which is a sign of COPD. But spirometry isn't the only test. Sometimes, doctors perform lung volume tests to see how much air your lungs can hold. These tests measure the total lung capacity, residual volume, and functional residual capacity. They help identify if air is trapped in your lungs, a common feature of COPD. To do this accurately, a machine called a body plethysmograph is often used. It's like sitting inside a small, sealed booth that measures how much air is in your lungs at different times. Another useful test is called a diffusing capacity test. It checks how well oxygen moves from your lungs into your blood. This is especially helpful if emphysema is suspected, which damages the lung tissue and makes oxygen transfer less efficient. Doctors may also use pulse oximetry, a quick and painless way to see how much oxygen is in your blood. It involves clipping a small sensor onto your finger. Sometimes, doctors ask patients to do exercise tests, like walking for 6 minutes. This shows how COPD affects your breathing and oxygen levels during activity. Along with these tests, your doctor will ask about your symptoms, like a chronic cough, shortness of breath, or sputum production. They will also review your history of exposure to lung irritants, especially cigarette smoke. Imaging tests like chest X-rays or CORT scans are also part of the process. They help rule out other conditions and look for signs of emphysema or bronchitis. In the end, spirometry is the main test that confirms airflow limitation. The additional tests give a clearer picture of how severe your COPD is and what areas are most affected. This information guides your doctor in choosing the best treatment plan and monitoring your condition over time.